pediatric cardiologist. I trained at the Medical College of Georgia for med school, residency, and fellowship because I got married and stayed. I did pediatrics, then a fellowship in pediatric cardiology, which is 3 years. Then I moved initially to Louisiana for 2 years, and then I was hired by Dr. Ginger Tournier to come to Boca Raton, Florida, and I've been with MEDNAX for 24 years.
How did you get into the field of medicine, and were you possibly inspired by a woman to enter the field?
So interestingly enough, I'm one of 4 girls. 3 of us are doctors.
Wow.
So my sister, who is 6 years older than me, first went down the path of medicine, and she's a pediatric surgeon, and she went to the same med school I did. I initially went to Clemson University, and when I went there, I thought, I'm going to do law, but I couldn't write a paper without my now husband's help, so I decided law was probably not the field for me. So I tried to change to pre-med, but I was already so far in my career, I ended up going to University of Georgia and getting a degree in zoology after my degree at Clemson before going to med school, and I went to the Medical College of Georgia there. My younger sister, who is 2 years younger than me, went to University of Georgia and went to med school at Mercer in Macon, Georgia, and she is a emergency room physician in Los Angeles.
What do you think it means to be a woman in healthcare today?
It's a lot better than it used to be back in the day. So my sister, who, as I told you, is a ped surgeon, had it pretty rough for a female going in surgery. It was not accepted. She was pretty much tortured by everyone from the clerks, nurses, doctors, anybody you can think of. But by the time I got there, it had improved because especially where I trained, the chief of surgery's daughter went into surgery. So then all of a sudden it's accepted. No one say a word kind of thing. Now in other fields, of course you're gonna face, I don't now because I've been doing it so long, but I do see female students who get looked at as more on the female side than the medicine side because maybe they look very young and attractive, and that in and of itself makes people not respect you right on. I think you definitely have to hit the ground running and be confident. But then on the other hand, I would say let it roll off your back. You can't spend your whole life fighting people because you're a woman. You're there to do a job, and you learn that job well, and you take care of your patients. And if people have a problem with you, that's their problem. Mm-hmm. You have to sort of decide that early on, wherever you are, and then you're not going to be fighting it in your mind all the time. Sure, I had things in training, guys would, say things to me, and I would go, look, first of all, I'm married. Don't hit on me. Second of all, you guys are a lot of fun, but don't talk to me like that. And then it's over. Yeah. They're going to try. And then once you shut them down, they're going to be friends. And then after that, they would just torture me. When I was a resident in a different field, they would go, hey, come look at this x-ray, and they try to freak me out as a co-doctor, not as a woman.
So you sort of spoke to some of the challenges. Any other challenges that you experience in the field of medicine?
I think the problem for women, I tell med students and residents all the time, when you're in medicine, med school is hard, no doubt about it. Residency, harder. Life, harder. Everything's harder as you go on. I think people, when they're choosing their field, they don't look far enough down the road. What does my life look like when I'm 35, 45, 55, 65? Because you are a woman. Theoretically, you may want to get married and have children, and you're going to be the mother, right? So if you pick something very difficult where you're never home, you're setting yourself up for struggles. And I always tell people in med school, you will like a lot of things. Right? Very few people show up to med school and go, I'm going to be a neurosurgeon, I'm not deviating off this path. So you go through things and you like them and you find what you're good at. And I always tell them, look at the people in the field, the other physicians, look at the patients, look at the nurses who are gravitate to that. Is that something you want to see your whole life? Because if not, look elsewhere. Because you need to look at your life down the road so that the challenges you face are not as difficult as they might be if you choose something harder. I think that's why women go in peds. I think that's why women go in other specialties that aren't as vigorous. Of course, they're in every field, but I think in the field of pediatrics alone, the residents are over 50% women now. And that tells you that, women are natural nurturers. They eventually are going to be mothers, and they relate to the patients and the mothers. Not to say men don't, but it's a natural field to go into, just like family practice.
What are some of the positives that come from being a woman in healthcare?
If you go in pediatrics or any pediatric fellowship field, again, we're everywhere, right? So you have people to talk to, commiserate with, and people that will help you on the path. I am really very much in agreement with the mentor system, where you take someone who's young and help them when they're making their decisions going forward for fellowship. And even if they pick something and it's very hard, for example, in my specialty, there's a lot of subspecialty. So you can be an interventionalist, which can be very long. It's long days doing difficult things in the cath lab. You can be an EP specialist, a fetal specialist, you can be outpatient, you can be critical care, which again is a lot of sitting by beds, as I call it. So there's a lot of different things that you can do within pediatric cardiology to help with your need to be an intensivist or whatever your specialty is. And a lot of those things have to be done at tertiary care centers. So theoretically, you're going to have other people in that subspecialty, so you can have a life, and time off and so forth. Okay. I think, a lot of residents over the years have established guidelines within the field of medicine about, limiting resident hours and call time to protect their sanity. And we did not have that when I was in training, but I think it's important.
And you spoke on this a little bit as well, but any further advice for women who are applying to medical school right now, entering the field for the first time?
It's a tough specialty to be in. First of all, the school itself is hard. Now with this COVID stuff, it's really affecting education. There are students who are asking their school to take a gap year because they're not being able to do the rotations. If you can't do your rotations, how are you supposed to make decisions, about what you want to do? So it's a very weird world, and I'm interested to see how it's going to impact. Nothing ever is a rubber band that slings back, to the way it used to be. So there's definitely going to be changes. I think that we need good doctors, and it's going to teach us a lot about the front line and residents and how they use residents. You're throwing people who just finished med school into front line of a quarantine. That's pretty scary. But I bet I'm not on the front line of COVID, but I bet there are people in very big COVID, hot spots that are expecting those residents to jump in and, do the part. So I think people are going to go, wow, it is a risk, just like it's a risk being in the military, right? So I think those are things people need to stop and think about. Okay. It's definitely not a field to go into if you just want to make money, because it's very hard. Right. It's a hard road, and you are earning that money.
You spoke about a little bit how women physicians can support other fellow women physicians in terms of mentorship. Anything else on that end that you want to touch on?
I think, we're all very busy, but I have throughout my career with MEDNAX tried to, go to the med schools and give lectures on peds cardiology, attend, different things, just to sort of see if people have questions. Most med schools in my area are very good about trying to have mentor programs. They'll email you and say, hey, this person has a lot of questions about pediatric cardiology. Can they come over to your office? I think that's a very good thing. We have another hospital system where one of my partners teaches residents all the time. And, they'll rotate through my office, and I'll talk to them about, why are you interested in peds cardiology? Here's what it's really like. You need to make an educated decision. Once you're in med school and you're there, you're pretty much going to stay unless you made a wrong decision, and they want to keep you, right? So it behooves you to get as much knowledge as you can from women and people in that specialty you want to go into, because they've been through it. You need people that are going to tell you as you make your steps, here's how you're going to get noticed in this. Here's what you need to do to, do a fellowship in that. And, people have questions, and obviously I'm, in the middle age spectrum, and 100 years ago I trained, but I do know what it's like, in all those training phases. My own daughter's pre-med. I've tried to talk her out of it multiple times, but she's walking that path. And it is vastly different, what they do in college and, med school. So we all have to help them, get through it.